Hello everyone, my name is Shikha Patel Shah, and today I will be presenting my evidence-based practice project focused on improving postpartum outcomes through extended follow-up cares and structured mental health screening. This project addresses a major gap in current postpartum practices where patients often receive only one follow-up appointment at 6 weeks visit. During this presentation, I will talk through the purpose of the project, supporting evidence from the literature and proposed interventions, and how these changes can improve outcomes in nursing practice. So let's get started. Starting with the purpose and the issue, the purpose of this project is to improve postpartum care by extending follow-up beyond the traditional 6-week visit and implementing structured mental health monitoring. Currently, postpartum care is limited and often fail to detect complications sooner. This creates a significant problem because many conditions like postpartum depression or postpartum hypertension develop after discharge and then can often go unnoticed. Miller and his colleagues, the writers, found that structured and collaborative care models significantly improve depression screening and treatment rates. This highlights the need for a more proactive and continuous approach to postpartum care. So let's talk about the background and significance of the project and about postpartum recovery. The postpartum period is a critical time for recovery, especially with the first 12 weeks after delivery. However, many healthcare systems still rely on outdated models that include many of the follow-up visits. According to ACOG, postpartum care should be ongoing and individualized. In addition to USPSTF, recommends routine depression screenings as depression from postpartum affects approximately 1 in 7 women. Without proper follow-up, many complications are missed, leading to increased maternal morbidity. These issues are more pronounced in underprivileged populations where access to these cares are very limited. The literature strongly supports the need of improved postpartum care. And this you can see in Miller and his colleagues' papers as well that I have mentioned at the bottom of the slide. That demonstrates that collaborative care significantly increases depression screening and treatment. Chap and his colleagues showed that system-level changes such as default scheduling improve follow-up attendance. Additionally, other writers such as Struber-Wasser found that remote monitoring improves early detection of complications like hypertension. Together, these studies show that structured proactive care model can significantly improve maternal outcomes and reduce these complications. And now, speaking of the EBP model, this project is guided by the IOWA model of evidence-based practice. The model begins by identifying the clinical problem, which in this case is inadequate postpartum care, follow-up, and the next steps involves reviewing and appraising the evidence to determine whether a practice change is necessary. After confirming strong evidence, the intervention is implemented. The outcomes are evaluated. The final step focuses on sustaining the change in this practice. This model ensures the project is systemic and evidence-based and more sustainable. So let's talk about what the proposed interventions would be. The proposed interventions includes implementing structured follow-up visits at 2-week, 6-week, and 12-week postpartum visits. During these visits, patient will be screened for depression using the EPDS and monitored for complications such as hypertension, which is very common. Education will be provided on warning signs and when to seek care or to seek for care. Additionally, reminder systems such as text message alerts, phone calls will be used to improve the adherence and attendance. These interventions align with ACOG recommendation and addresses gaps in the current postpartum care. So, the target population includes postpartum individuals aged 18 and older receiving care in an outpatient setting. The sample size will be approximately 75 participants or subjects, which or who of them are feasible for implementation and evaluation. Participants will be recruited during hospital discharge and initial postpartum visits. Inclusion and exclusion criteria will be applied to ensure appropriate participant selection. This methodology allows the intervention to be integrated into routine clinical workflow, which maintains feasibility. When it comes to data collection, ethical consideration include obtaining informed consent, maintaining confidentiality, and ensuring voluntary participation. Participants will be informed of their rights and can withdraw at any time. This data will be collected using electronic health records and the Edinburgh Postnatal Depression Scale, as I mentioned previously, which is EPDS scale. Which is a validated and reliable tool. Using standardized tools ensures consistency, accuracy in data collection, which is essential for evaluating the effectiveness of the interventions. Primary outcome of this project includes reducing postpartum depression scores, increased follow-up attendance, and improved early detection of complications. These outcomes will be measured using an EPDS and electronic health record data. The evaluation plan involves preparing pre and post intervention data to assess effectiveness. Statistical analysis will be used to determine whether the intervention leads to significant improvements. These outcomes align with findings from Miller and his colleagues, supporting their relevance. This project is highly significant for nursing because it improves maternal health outcomes and supports the role of APRNs in delivering evidence based care. It also addresses disparities in postpartum care and promotes patient-centered approach. Project is innovative because it moves beyond the traditional 6-week model and integrates both mental and physical health monitoring. Findings from this project will disseminate through presentations, conferences, publications to promote, adoption in other healthcare settings as well. And these are the references used to support this project. All sources are evidence-based and includes clinical guidelines and peer-reviewed research articles. These references provide strong clinical support for proposed intervention and align with current best practice for postpartum care. And then the next page is also just a continuation of our references. And lastly, thank you to everyone for watching this presentation.